Hello and welcome to today's edition of Inspirational Focus. I'm Craig Klein, a deacon in the Episcopal Church, and I'm very honored today to have as my guest Mr. Ronnie Jeffrey, who is a VFW lifetime member and U.S. Air Force retired. And we're going to talk a little bit about the unique work he does that involves its own particular brand of spirituality and helping. Welcome to the program.
I'm glad to be here.
Good, glad to have you. So, I met Mr. Jeffrey in a meeting for volunteers at a local hospital, and he was sitting at a table composed of chaplains, and I am one there at that local hospital. And I got into a conversation, and I discovered that he, in fact, actually is not a chaplain. But he has a strong motivation to serve. He's called to do this kind of thing, and his take is unique. And today we're going to find out ways that you can do provide service and in fact inspirational or perhaps spiritually based service to folks without having to be a chaplain or certainly not ordained clergy. And we're going to find out how you do that right now. Right. So, if you had to describe yourself or the work that you do, you primarily work with who or in what situation?
I'm a hospice volunteer in Gallipolis.
Okay.
And I work strictly with veterans.
Okay. I want to talk about how you came to be that way or have work strictly with veterans. We have, of course, VA hospitals, and we have social workers, and we have chaplains in many, many places, and formal hospice organizations. What do you bring? What do you do that's unique in that world?
I wear a ball cap that has Vietnam on the front of it as a thing. And I talk to many different types of veterans as they come up and shake my hand, and I talk and ask them. And then I ask them, do you have all your VA benefits? Mm-hmm. And I get a lot of people that tell me, no, I gave up on that. I didn't. They offended me or did something to me and didn't react to that. And I encourage them to go out and reapply. Mm-hmm. And then once I talk, some of them do that, but I find many of them don't. Then I was in VFW down in Alabama, and the hospice came in and gave us a presentation. And so I have three uncles in World War II vets up here, one's 98. And so I started figuring out what is it that I can fill in my time with. And so I decided that I remembered the presentation in Alabama, so I went to the local hospice people down here, and I went through 6 hours of training to what to do, the paperwork that's required, and that kind of thing. And so it's very extensive. Basically what I do when I go, most of my stuff's in the home with the veteran. Mm-hmm. I'm there for the whole family, just not the veteran. Okay.
So you're there providing not just information, but being a presence as well. So sort of vet to vet?
Vet to vet.
Okay. I found a slide doing some research for this program, and could you bring up the slide that has PTSD on it, please? Okay. So it says PTSD and emotional trauma affects partners of veterans too. So yes, I thought this might be an example of the family and the vet as well, or at least something you might encounter in your travels.
I have personal experience in that area, but also I had a young man that I went to see, and his problem was that he was in the Army in Vietnam, and he was not sure that what he did there was so bad that he would not be able to get into heaven because of it.
Oh my.
And so I sat down with him and I explained to him what I feel like the scripture says, mm-hmm. that it's okay to defend your country, defend yourself, and defend your family, and defend your religion. Mm-hmm. you're not going to be held accountable if you do those things.
All right.
Now, you just can't go out and indiscriminately do those bad things, but if you do it in those contexts, I believe that you are going to not be held accountable for that, and that eased his mind.
Okay.
He had
So-
bad dreams and things of that nature
Okay. I'm assuming you visited him more than once.
for about 6 months
Wow.
before he passed through the veil.
Okay.
And we have many different conversations about that. And
Okay.
I myself went through, after Vietnam, went through a small case of PSDT in that if I'm sleeping and you touch me, I come up out of the bed.
You'll rise quickly.
You're, it's either the fight or flight syndrome.
Okay.
But if you come in and spoke my name, then I come up out of my sleep and no problems.
Okay.
So that I have, I had that, and I've worked my way through that. I don't know why I ended up with that, but
Okay.
it no longer affects me. But I understand that.
So
We used
you-
to call it shell shock when I was in the military.
Okay. So that was the former term?
That was the formal term,
Okay.
shell shock.
Shell shock. Okay. So, but clearly you can induce reactive behaviors with things other than shells just simply by touch.
Yeah.
Okay. So you work, you represent hospice, or you are a kind of hospice worker?
Yes, I am.
Okay. Did you have to have any training for that?
I had about 6 to 8 hours of training with a social worker in the hospice. They explained to me, like everything, you have paperwork, you got to fill out this form and that and the other to document what you've done, what you talk to them about. They also trained me on their beliefs in death and the last stages of death. And a lot of hospice now, I believe, has a bad reputation in that they're the last resort and stuff, and they're not. They can really help you. For instance, one of my uncles is in hospice care, and I go see him as a hospice volunteer. Plus, he's my uncle also. But his health has, in the past 3 months, greatly improved because of their presence in the home. And they make sure that they wash him, bathe him, shave him if necessary. They have a social worker that has a guitar, and she goes in and sings to him.
Sings to him? Okay.
And
Do you sing to people?
if I sing in the shower, I have to give my family a 30-day notice.
I see. Okay. So how is it that you become aware that these people, A, are veterans? How do you find that out? I'm assuming someone comes and tells you, and then make that connection so that you can actually go for a visit. How does the word get to you that there's a veteran in a facility somewhere?
Okay. A doctor will take a patient and recommend hospice.
Okay.
There are service workers that will go in and interview with the patients and their families, and they get signed up for a hospice. And part of their interview is a checklist, and on that checklist is, are you a veteran? And then they turn around and ask them, would they like to have a veteran come and meet with them and talk to them about the VA and other things. So then they tell me, and then I go into the family and introduce myself. And I fill out checklists that I have and talk to them about it. But mostly I'm there as a friend.
Okay.
I develop close relationships with my people. They're like family to me. I'm there on call 24 hours a day if necessary for the caretakers and stuff.
So have you gotten the late night call?
No,
No?
because most of the veterans in hospice sleep through the night.
Okay. There you go.
Most of the time, if something happens that the veteran has passed on through the veil to the other side,
Okay.
then I get notified the next day by text, and then I go out and meet with the family
Okay.
and just talk with them.
So you get a call that someone's in a facility. It could be a hospital
It could be a hospital.
It
I've
could be
had
a
one
V-
in a nursing home over here,
or a nursing home or a VA facility
or a VA facility here.
or someone in a a hospice-like setting, even if it's their own home. So people will notify you that there's a veteran in some stage of care. And so you're going to at least 4 different places, 4 different kinds of places as well. So
I
do you,
usually spend 1 week, 1 hour a week with all my veterans. Now, every so often we'll get a unique situation, such as a young lady came into hospice. Her husband is a Korean veteran, but he's not in hospice, but I've been asked to go visit with him so that he'd have somebody other than just the women coming in and out, and so that he'd have a man to talk to,
okay,
and also with similar backgrounds.
okay.
And he just happens to be Air Force also, so we speak the same language.
There you go. And I was going to ask, what are some of the unique things that a vet can do for another vet? So, I'm clearly speaking the language is one of them.
Yeah. I had one young man that had been fighting with the Veterans Administration about his VA benefits. He had PSDT, he has chronic heart condition, kidney conditions, liver conditions. And so when I talked to him, and because of his PSDT, he would go into the facility with both guns blazing. Well, when they did that, it turned him off. They were very reluctant to help him. So I looked at the paperwork and I talked to his wife, and I said, we're going to go back together. I'm just going to go in there and sit down, and you sit there and keep your mouth shut. And you do all the talking. 3 weeks later, he was at 95 percentile and started to receive his full benefits.
Oh,
I mean, he's already getting the VA hospitalization. He got the medical, that kind of stuff.
okay.
But that's the tiny things. And if they don't have the VA, then I encourage them to go down and actually go on with a couple of them and have them sign up with the VA.
Okay. Now, in conversation with you as we were preparing for this telecast, I discovered that there are actually 2 kinds of veterans, 2 different categories of veterans.
Yes,
Can
sir.
you please tell me what those categories are, or tell our viewers too.
There are those who are in the military that do not get to go to a combat veteran area, such as in Vietnam. There were a lot of people stationed in Germany and in the European theater. A lot of people was back here in the States in logistics. They are called combat era veterans. Means they were in the military, but they didn't go to the actual combat situation. The bottom 3 ribbons on mine is where I actually spent time in the Vietnam for a year. They are called combat veterans, and they are the only difference in the 2 basically is that the combat veterans actually can get disability. For instance, Agent Orange at the time, which was later called Agent Blue, which was called Agent Green, which, multi-colors, defoliaging agents. It causes blood pressure problems, they cause diabetes, heart problems, kidney problems, and they call that presumptive diagnostics. And if you've got one of those things on that list, then you automatically get a percentage as a retirement type deal.
A percentage of your pay?
Well, there's a scale.
There's a scale, okay.
Okay, 100% is about $3,100 a month. 10% is about $150 a month.
Okay.
Tax-free, this to help offset the cost of your medical that you get.
All right. I'd like to remind everybody that this is Inspirational Focus. My name is Craig Klein, and my guest today is Mr. Ronnie Jeffrey, a hospice volunteer and former member of the United States Air Force, now retired, and a lifetime member of VFW.
Yes, sir.
And talking about the unique kinds of service and, can I use the word ministry, that you
I don't mind.
you can provide.
You can call me anything
Provide
you want.
people, okay? I'll call you Mr. Jeffrey. So, it's interesting. So clearly, if you have the badges on the 3 bottom ones on your uniform there, and this is the United States Air Force uniform,
Yes, sir.
Okay. That means that you are not a combat era. You are actually a combat no era
Combat
veteran. Okay, veteran. Okay. So, are most of the folks you encounter combat veterans, or is it kind of a mix between the two?
About 50-50.
Okay. All right. And when you go to visit people, do you go dressed like this?
No.
Okay.
I wore I got a U.S. retired Air Force
Like a baseball hat?
baseball hat, or else I
yeah.
got my Cameron, I should say, my Vietnam veteran hat also.
Mm-hmm.
And I wear those two hats a lot of times just to strike up conversations with people.
Okay.
And I get it around to where we talk about their VA benefits that they can get,
Okay.
and the help that they can get there, and encourage them to go out, and if they see somebody in need,
Mm-hmm.
call somebody. Just don't let the veteran sit there without any help.
All right.
PSDT is a prevalent problem, especially in the new era of combat in Iraq and Iran, in that you're more unlikely to get killed quicker in those type of environments than you did in Vietnam and Korea.
Okay. Can we see that slide again, please, for a second? That there it is. So we clearly have the partner and the veterans, so we could presume that this was probably a combat veteran.
Probably a combat veteran, looks like maybe a member of the family
Okay. There
because
you
of
go.
the size of the feet and the legs and stuff.
Okay, sure. And are women folks that you also see? Do you see female veterans from time to time?
I have not had that opportunity yet.
Okay.
That probably will come as we go downstream in time.
Mm-hmm.
There are a lot more women in combat situations nowadays in the Afghanistan and the Iraqi arena.
Okay.
I've learned many stories. In PSDT, I would like to, at this time, take a couple minutes and relay a story that was told to me by one of my veterans.
Okay. Is this something that you feel induced PTSD or helped contribute to it? Tell your story.
It was.
Okay. Tell the story.
First off, war is hell, not only for the person over there fighting and supporting them, but also for the family. Many times it's more more problematic with the family than it is with the veterans. For instance, while I was there, I was focused, as most of us, we got a job to do, we go do it, and we don't worry about too many things. We write home, call home now, but you got to look at what's left behind. The parents, the brothers and sisters, many times wives and children, they go through the same things that they did before I left to go. House over their heads, food, gas, electric, telephone, earning money if they have to. And all the time they've got this thing sitting there. They know that if a car pulls up and two military people get out with hats under their arms, something has happened to their loved one. And that's always there. That's that pressure that we don't experience, that they experience. For instance, one of my young men that I met in this, right here from Gallia County, joined the Army. They shipped him to England. About 3 days after they liberated Paris, they sent him down there. He was an automotive mechanic. Excuse me. He had a very good friend back here as he grew up that lived just down over the hill. The two families were sharecroppers. His friend joined the military army, got into England. A truck accident happened. He got rolled over, and he was killed. My friend got on board ship later on downstream, was sitting on a ship out in the middle of the Pacific over the Mariana Trench, getting ready to invade Japan. They dropped the two bombs. Japan said, "I've had enough," and they turned the ship and brought them back. But what happened to this young man that was killed is horrific at the least. His father went crazy, went into an institution, worked his way through and came out. Didn't spend more than 6 months out and went right back into the institution, spent the rest of his life there because of his son's death in the wartime. The mother, she also just withered away and died of a broken heart, as they would say.
So you have people that are grieving very heavily, grieving for the loss of a child and the loss of a family member. What would you say to someone in a situation like that? Clearly you're a presence, but you're more than a presence, because you would interact with them, wouldn't you?
Yes, sir. I believe in the scriptures. And most of the time I will explain to them what I understand the scriptures to be. It's okay to do these things. He was in service of his country.
Okay.
Evidently, the Lord had need of him on the other side, and so the Lord took him. And they should not. They have the right to grieve, but they should not mourn that heavily, because he would look back down through and he would also mourn because you're mourning. But
So,
you need to.
does that comfort them when they hear things like that?
I found it to be comforting. I also explained to them that, according to the scriptures, upon our death, our body and spirit separate. The body gets buried, or many different things could happen to the body, but their spirit goes directly to heaven. And it's just like birth. We came from someplace here, the door opened, we were born to parents, lived our lives doing the best we can. And then death is nothing more than the opposite of birth. It's the opening of a door, and you go through this curtain or veil or the door, whichever you want to call it. Now on the other side, those that have gone on ahead of us, there's a big family reunion going on. Mothers and fathers and grandfathers, and your memories are intact of all of them. Those that you've never met, you will know them. It's a big family reunion. And then they take you on a grand tour.
Okay. So I understand. So I was going to ask you in some detail what motivates you to do this kind of work, and I think you just told me. I think you just explained it to me. And
I was asked that question several different times, and my only answer I can really give them is, why not?
That's right. Why not? Okay. And you do it. And I must confess that I've met few, if any, people who fill the niche or the need that you do in the unique way that you do it. So I have a sense now, after talking with you, of why you do what you do and what motivates you to do it. And clearly you have expertise, veteran to veteran. And I realize, as we're going to start winding down the program, I haven't asked you about how you're dressed. So what is this the uniform of? What was your rank?
I'm an E7 Master Sergeant.
And I can tell that by
the chevrons.
the chevrons? Okay.
The old chevrons used to have, and they didn't have this upper piece on it. They had 3 on the bottom with the other 3. Airman 3rd class, Airman 2nd class, Airman 1st class, Staff Sergeant, Tech Sergeant, then the other one was a Master Sergeant. And then when you got the one rocker on the top, then you were Senior Master, then Chief Master. Now, they changed it about 7 or 8 years ago so that the Army, the Marines, the Navy, and the Air Force now have all similar types of stripes or chevrons together across the board.
All right.
It's kind of hard for me to get used to, but because I'm an old Corps person.
Can we see the logos, please, again, of the Air Force and the VFW? Okay, I was just wondering if there's no chevron
No.
on the Air Force logo that I can see, nor on the, for that matter,
Okay,
on the
that's the logistics symbol.
Okay, there you go. So the chevron itself tells you that, and anyone who's been in the service would probably recognize what all of the individual items are here. All of that.
The Vietnam ones are the same across all the
Okay.
services.
Okay.
Now, my good conduct medal happens to be blue. Armies, I think, are red, and then the Navies are dark blue.
Okay.
But they all symbolize the same types of things.
All right. So would you ever wear your uniform when you go to visit a veteran? Would you ever dress as you are now? Or
Not
that would
yet.
be
Normally, I wear it when I go to the viewing and when I attend the services
okay.
at the gravesite. That's
Okay.
when I wear the
So
uniform
you're there with them for their whole transition.
for the whole transition.
You're there for the whole thing. That's remarkable.
Best non-paid job I ever had.
Really? Okay. Good. Good. I'm very glad to hear it. In so many ways, it parallels concepts that involve chaplaincy and healthcare practices, best practices, those sorts of things. There are a number of areas of intersection, points of intersection. That you do this voluntarily and that you decided to do it on your own, I think is frankly remarkable. How many people do you see at any one point in time? How many do you have now?
One time I had 8 at one time. I spent an hour with every one of them once a week.
Okay.
If they require, if I see that I think they need extra visits, then I'll go back to my supervisor and says, I need to go see these people again.
Okay.
And then I will brief them on what I saw.
Okay.
So when the nurses come in, they can look for some of the same things.
Okay.
And but right now I have 3.
You have 3.
3 active.
Okay.
Military.
How far do you go to visit these folks? Are they all local?
Whatever's required.
Whatever's required.
I've been as far out past Jackson, and then up to Racine.
Okay.
Racine's a nice place. I can a lot, and so I get my
Get
my vegetables.
up there and fruit and stuff. Okay. So, I think it's remarkable. Many of us talk the talk. Many of us study formally for long periods of time to do the kinds of things that seem to come naturally to you, and that is something to be thankful for, and to praise. And I'm certainly grateful that you do these things. And
After a few visits, if I think it's necessary, then I will start a regimen of prayer before I leave.
all right, that's terrific. I'm really grateful that you spent some time here today.
I'm grateful I was invited, and I
Okay.
enjoyed it.
Well, this is Mr. Ronnie Jeffrey, a man who truly walks the talk in some unique ways. And I'm really grateful for your time. I'm Craig Klein, and you've been watching Inspirational Focus.